I'm sorry I missed Monday. Um, just couldn't get to you on Monday at 9:30. So it's Wednesday, October 14th, 9:30 Central Time in Boonville, Missouri. We started a series last Thursday on the Art of Floundering podcast on domestic violence. Kind of my idea. And we're probably going to work around different issues with domestic violence, and it doesn't always have to be violence per se, like physical violence. Although all of that seems to have increased this year. Domestic abuse, domestic violence is on the upswing. So is suicide. So is addiction. So is falling back into addiction. So what I'm going to talk about this morning is complex post-traumatic stress disorder. So PTSD you've heard of. You may not have heard of the term complex PTSD. The difference is really the chronicity. So any traumatic event can cause a person to have post-traumatic stress disorder. Um, so witnessing death or witnessing a horrifying car accident or a near-death experience for yourself. But when it's a chronic thing, it can become what's called complex PTSD. Not everybody agrees with how to diagnose that, but chronicity, from everything I read and everything I've experienced, seems to be part of the deal. It's a chronic reaction to remembering traumas or staying in a traumatic situation, domestic violence, emotional abuse, sexual violence, all that. So what we're going to talk about first is some brain stuff, because what we're finding, or what they're finding, is that PTSD, and specifically chronic or complex PTSD, actually alters your brain function. So things shrink, things get bigger, neurotransmitters get different. So traumatic stressors really are defined by a direct experience, witnessing of or confrontation by an event, even actual or threatened danger, and they evoke responses that include fear, helplessness, and horror. Okay, so what does that do to you? Well, it does a lot to you. Okay, so and we're not going to talk about treatment. I'm just going to talk about kind of what happens in your head, in your brain, and kind of what that feels like from some stories that people have written about. So what you're triggering is your sympathetic nervous system and your hypothalamic pituitary adrenal axis, so fight or flight response. So they're both activated as a response to stress, and they work in concert to promote adaptation, homeostasis, allostasis, by enabling people to adapt to changing conditions in their environment, right? So in relation to stress, the big players are cortisol, norepinephrine, and epinephrine. So during stress or trauma, the fight or flight response is activated. So epinephrine increases your heart rate so that you can move fast and get out of danger. Norepinephrine sends blood to large muscle groups into your lungs. Your pupils dilate. Cortisol is released. And we've talked about chronic elevation of cortisol in the past. Okay, it's part of the chronic illness mode that gets us in trouble. So cortisol elevation that is chronic can suppress your immune system. It can lead to insulin resistance, obesity, type 2 diabetes, heart disease, etc., etc., hypertension. So emotions intensify during the fight or flight response, and then the limbic system kicks into full speed. Okay, and so the frontal lobe, your frontal cortex that helps you make decisions, kind of gets suppressed, and the reptilian part of your brain takes over. So you're going back into ancient time or ancient behaviors based on very ancient parts of your brain. Okay, so parts of your brain regions get flooded with signals from hormones and neurotransmitters. Okay, and two of the critical areas that have been found to be altered and actually change in size in response to chronic stress and complex PTSD are the hippocampus and the amygdala. Okay, so the amygdala, we talked about this in physiology, that's actually on their test tomorrow. So the amygdala is very small, it's in the midbrain, but it's amazingly powerful. So when the amygdala fires um, in an intense way, so this is your fear, the fear part of your brain, then a physical stress response is triggered in the body. And so when the amygdala sends an SOS, the hypothalamus activates the sympathetic nervous system, sending signals to the adrenal glands. And so conditions such as anxiety and depression, PTSD, and phobias have been linked to abnormal functioning of the amygdala. So the amygdala orchestrates the fear and emotional response to an experience and sends signals to the brainstem and then the frontal cortex where you make your executive decisions is bypassed. So it's straight from the amygdala to the brainstem where your respiratory and cardiovascular center is, where you're monitoring your body. I told my students last week that theoretically, um, you, I'm not going to say you would be alive because then we're getting alive because we're getting into the definition of death. But if you could remove somebody's cerebral hemispheres and keep their brainstem intact, they would continue to breathe and have a heartbeat. Okay, so that gets in, like I said, into the definition of death. So research on PTSD is evolving. It's complex. And complex PTSD is even more complex because PTSD can come up from one event. And usually it lasts longer than 30 days. So the diagnosis, and don't anybody try to diagnose yourself if you are having any of these symptoms that we're going to talk about. Make sure you see somebody that can actually figure out whether or not this is what's going on. So cortisol is the stress hormone. Okay, so cortisol elevation in the blood and the brain happens in response to stress. So the relationship of cortisol to PTSD, though, has been varied. So early work with people that had survived extensive chronic trauma in the Holocaust found that they had lower than normal cortisol levels. So that's paradoxical, right? Because trauma elevates cortisol. But it may be that the low level they're thinking either reflects some compensation response to the elevated cortisol at the time of the trauma or a phenotype, so a genetic um, variant that helps people resist the effects of stress. So studies of acute trauma, so right after it happens, show elevation of cortisol, and then higher plasma cortisol correlates with symptoms of PTSD. So if you witness or are involved in an acute event and you get a high cortisol level, you're more likely to get PTSD. Okay, and so then many of the findings in the levels of norepinephrine in relation to cortisol are important. So cortisol alone is not predictive, as the combination of cortisol and norepinephrine levels in defining PTSD, but it appears that low cortisol levels together with high catecholamines may reflect a late event in the natural history of this disorder, which may come about months or years after the trauma. Okay? So across your lifespan, you have to be able to respond to stress appropriately. It's critical in maintaining optimal health. Okay? So the major excitatory, as my medical school neurologist used to say it, the major excitatory neurotransmitter in the brain is glutamate. Okay? And it's also key in memory formation, so it's a crucial role in human stress response, probably plays a role in the pathophysiology of PTSD. So release of glutamate leads to long-term changes in synapses and plasticity, they call it, that is how you store your memories and where it's encoded. Okay, the neurotransmitter GABA, G-A-B-A, gamma aminobutyric acid, inhibits that. So that is why benzodiazepines can lead to amnesia. Okay, benzodiazepines, and any of you in my class that are watching, that exact question's on the test tomorrow. How do benzodiazepines work? They raise GABA, so it inhibits. And so people that take benzodiazepines have been found to sleepwalk or sleep drive. They forget, they have amnesia. They don't remember what they're doing. Okay, so GABA is the main inhibitory neurotransmitter, and it suppresses stress-induced actions of the amygdala. Okay, so gamma receptors in the amygdala appear to inhibit glutamine excitation. Okay, serotonin system is also important in interactions with the adrenergic and glutaminergic and GABA and dopamine systems. Okay, and then dopamine during uncontrollable distress and stress, the amygdala activates to produce prefrontal cortex dopamine release. What we don't know is there an alteration of dopamine that has an effect in long-term PTSD. Okay. Okay, so enough of all that stuff. But some of my students may be watching this and they just got a question, right? Good morning, Wendy. Good morning, Holly. Okay, so so complex PTSD is a condition in which a person who's experienced multiple or prolonged traumatic events develops symptoms similar to those of PTSD, and it changes the way their brains work. So there's changes in the amygdala and changes in the hypothalamus and the hippocampus specifically, and changes in neurotransmitter release. Okay, the other name for this is complex trauma. I've got several different names that people have suggested for complex PTSD. Okay, so rather than resulting from a particular event, this is happening over a period of time. So it can develop after an experience of any physical, emotional, or psychological damage, so death of a loved one, physical assault, witnessing a tragedy. The development of complex PTSD is usually linked to repeated experiences of such damage. Okay, some of the common causes of complex PTSD are childhood abuse or neglect, domestic violence, which is why I mentioned the podcast. We'll continue on shame, domestic violence, and emotional abuse Thursday night at 7 on the Art of Flattering podcast. So emotional abuse, which to me is probably far worse than physical abuse. If you've ever been emotionally abused, you'll know what I'm talking about. Repeated sexual or physical assault, so there's the physical part of it. Experiencing human trafficking as a person being trafficked. Living in a constant war zone can do that. And prolonged exposure to combat or being a prisoner of war, so complex PTSD in prisoners of war. Okay. Most of these people get misdiagnosed because complex PTSD is not in the DSM-5 manual of psychiatric diseases. It's linked under PTSD itself. But a lot of people consider it a separate and distinct diagnosis. Specifically, in 2018, the World Health Organization recognized complex PTSD as different than PTSD. Most of these people are in psychotherapy. Some of these people take antidepressants. Most of them are taking selective serotonin reuptake inhibitors. Some think that helps, some don't. Some of them are misdiagnosed as attention deficit disorder or even borderline personality disorder, and that's a whole class. Borderline personality disorder is a whole class in itself. A lot of these people have been in outpatient treatment or inpatient treatment. Several are suicidal or carry suicidal ideation around. And most of the time, these people feel like they're defective. They feel fundamentally flawed, but they can't tell why. So it takes a lot of work to figure this out. So it's a fairly new diagnosis. Again, it's not in the current version of the Diagnostic and Statistical Manual of Mental Disorders. It's in its fifth edition. And because of the overlap of symptoms of complex PTSD with PTSD, it can be difficult to diagnose correctly, which is why the personality disorder, the ADD, etc. So the symptoms of complex PTSD are often more intense and variable than PTSD. And so since they're emotionally so intense, a lot of people are told they have borderline personality disorder. And like I said, that's a class in itself. Fascinating personality disorder. I think the best title of a book I've ever heard is on borderline personality is "I Hate You, Don't Leave Me." That's perfect. That's it. That's borderline personality in a sentence or a title. Okay, so the symptoms. What are the symptoms? So a lot of these people have flashbacks or they have nightmares. So they're insomniacs. They're night people. They have a hard time staying asleep because they wake up with these vivid dreams and nightmares and flashbacks. They can be depressed in their affect, negative mood changes. They get down on themselves and they get down on the world. They avoid situations that remind them of trauma. They can have physical effects like dizziness and nausea. They shake. They feel an adrenaline rush when remembering the trauma. They live in a constant and continual state of high alertness, which is known as hyperarousal. So if you've ever tapped somebody on the shoulder and made them jump, that's probably a person with hyperarousal. Just little noises, they'll jump. A little tap, a touch, simple little things that will trigger that epinephrine response that they really can't control. They tend to perceive the world as a dangerous place. Okay, the whole world is dangerous, so they I'm not going to say they're agoraphobic, but being out in public can be triggering for them. They lose trust in themselves and other people, so they have a lot of relational problems. And a lot of times the relational problems is the source of the complex PTSD. Okay, if you've ever been yelled at or called names in a relationship continually or frequently, and you're exposed to that long enough, it's going to trigger your amygdala response and your reptilian brain, and you'll start doubting yourself. So gaslighting, for instance, is a classic example of emotional abuse, where the other person, so that with relational complex PTSD, it's the other person may or may not know that there's manipulative behavior going on, but if they're doing it, then your amygdala will respond to it, and you'll go back into the ancient part of your brain. Okay, so these people are easily startled. So think about people that are easily startled. They probably have some heightened epinephrine HPA axis, hypothalamic pituitary adrenal axis thing going on. Okay, and in particular, so that's PTSD and complex PTSD, but for complex PTSD, these people tend to have difficulty self-organizing. They have trouble organizing. So a lot of people think that they have ADD, doctors or whatever. They have emotional dysregulation. They go from high to low very quickly. They have a loss of or a negative self-concept. So they beat themselves up. Not so if you got in a relationship where somebody is telling you that you're not good enough, eventually you will tell yourself that you're not good enough, and that's complex PTSD, especially if you get these other symptoms from that. And so a lot of these people have relationship difficulties. Okay, so there's changes in the brain, like I alluded to. So continuous exposure to the fight or flight response, adrenaline, norepinephrine, and cortisol neurotransmitters and hormones, and they create changes in biochemistry, and they are usually helpful to people that are in threatening situations, and then they go on with their lives. So they get out of the threat, they save their life, etc., whatever. But a complex PTSD person is continually experiencing these issues and trying to get away from them. Okay, so epinephrine or adrenaline, you've heard of it, increases heart rate, it increases your breathing rate, increases blood flow to the brain, the major muscle groups. It stimulates a huge amount of sugar release into your bloodstream to fuel muscles for flight and inhibits the production of insulin that would counteract that surge. So over time, these people are at risk for type of insulin resistance, metabolic syndrome, and type 2 diabetes. And epinephrine also decreases your ability to feel pain. So if you've ever known somebody that really can take a fair amount of pain that you would think would not, I'm not talking about sawing arms off or whatever, but people that just, pain doesn't really hurt. Pain don't hurt. What's that from? That's from Patrick Swayze movie, and Roadhouse. Pain don't hurt. Okay, so the problem with adrenaline, so the adrenaline rush is almost instantaneous. So you can run for your lives or fight off an attacker. The problem is um, the system has evolved over millions of years to react to sudden and unexpected dangers, but when you have prolonged danger, the system is constantly outpouring adrenaline and then releasing cortisol to counteract the effects of the adrenaline. Okay, so you're trying to downplay the epinephrine by releasing cortisol from your adrenal glands, and repeated exposure to epinephrine and adrenaline becomes addictive. So this is one of the addictions that may not really involve dopamine. Most addiction involves dopamine. Okay, so those are people that can become adrenaline junkies. So they seek out thrills and shocks, skydiving, racing, horror movies to get that rush. Okay. And then other people they fly from that. So there's kind of fight or flight, right? Fight or flight. So in addition to the addictive nature of epinephrine, constant exposure to adrenaline and norepinephrine and cortisol taxes that system and begins to wear down your organs. So the prefrontal cortex can't regulate the excessive amounts of norepinephrine released by the amygdala when you're consistently stressed. And so your cortex, where you think, where you make your decisions, loses its ability to discern the severity of any given threat. Okay? And so that's why that startle response that I was talking about. So tapping, this article talks about tapping somebody on the shoulder can create the same physical reaction as might a shark attack. Okay? And so imaging studies, so PET scans, functional MRIs, etc., have shown that the prefrontal cortex can undergo physical changes as a response to chronic exposure to stress, and it tends to get smaller. So one of the articles, personal articles I read, is a woman that had an MRI scan, and they noticed that her prefrontal cortex was smaller. I don't know if that was by comparison or just by an average, so smaller volume in some of its areas, so it loses some of its ability to cohese information. Okay, so the cognitive problems with complex PTSD, forgetting things, forgetting words, getting lost while you're going somewhere and driving, not being able to sleep, etc. Some people start feeling, and others around them feeling, that there's the start of dementia in these people. But if they have chronically been stressed and taxed by their adrenal glands and those neurotransmitters, then the white matter in their brain decreases and shrinks, becomes abnormal. Okay? So the amygdala, which I alluded to, your fear response resides in your amygdala, and your memory of fear in the hippocampus and the amygdala. So the amygdala is overactive and it increases in volume. So the amygdala gets bigger. It's small, it's bilateral, you got one on each side. But by constantly, repeatedly being exposed to trauma, the amygdala actually gets bigger. Okay, so it continuously is releasing norepinephrine. Okay, so there's where the hyperarousal comes. So it's an emotional state. So these people are triggered by anything remotely resembling their trauma. So a TV story, finding or seeing somebody that looks similar to their assailant, whether that's physical or emotional. hearing noises, seeing sudden movements, and then they're hypervigilant. So that's a physical state. So hyperarousal is emotional. Hypervigilance is physical, where these people are constantly jumpy, on edge. They're nervous. They shake. They have almost all have a resting tremor. They may see threats where there is no possibility of a threat, where a threat couldn't exist. Chronic wakefulness, chronic insomnia. Okay, and so one of the duties of the frontal cortex part of your brain is to control inappropriate physical action. So impulsiveness and movement impulsiveness when it's not really needed. And so since that cortex becomes impaired when overexposed to these hormones and neurotransmitters, complex PTSD sufferers may be less able to control their physical reactions when they're triggered. And so they can become violent, or they can be angry. They can soar up into the sky um, with anger and rage. Okay. So we talk in the physiology class about damage to amygdalas and the rage response. There's not a whole lot of, from the amygdala to the prefrontal cortex, there's not a whole lot of direct nerve interaction. So when that fear and those emotions take over, that's why it's difficult to control your emotions with your prefrontal cortex even normally. So everybody goes into states of rage at times where they get significantly upset and they can't control it. A chronic PTSD person has a bigger amygdala and smaller prefrontal cortex, so they really have difficulty controlling their emotional responses. Okay. Okay, so treatment, really psychotherapy, cognitive behavioral therapy, mindfulness practice, that's a whole nother class. Got a friend of mine, neurologist, that basically teaches mindfulness in Oklahoma City. There's some exposure therapy that's been used. EMDR is eye movement, I can't remember what it stands for, EMDR. And then meditation. Most people that have this and have been diagnosed think that the meditation and the mindfulness is the most helpful. Some think that SSRIs like Prozac, etc., Paxil, Zoloft are helpful as well. But the mindfulness practice, meditation practice, learning how to be in the moment is mindfulness. Learning how to breathe, how to deep breathe. It's amazing how fast deep breathing, sitting by yourself in silence, focusing on your breath, will do to reduce blood pressure and your heart rate. You don't believe me? Get excited about something and sit down and do that, because it will slow it. Also, you're sitting down, so I get that. So that is a primer on complex PTSD, and my guess is that this will come up again in the Art of Floundering podcast on Thursday, because we just started domestic violence, had a good discussion with the health professionals last week. I think we have a special guest this Thursday that's going to discuss shame, and then we'll kind of move into more on emotional abuse, domestic violence, and complex PTSD. There are two licensed professional counselors that are on that podcast that have lots of thoughtful discussions about these issues. So there's always, we've got a pharmacist, retired physician, me. We've got a life coach, health coach, physical fitness coach, nutritionist, and professional counselor. So it's a nice interaction. So I will talk to you Friday. I almost got called in to substitute teach today. I wouldn't have been able to do this. But Friday at 9:30, I'll come up with something else to discuss. And you all have a great day. It's nice fall weather here. And I will see you Friday. See you later. Bye.